Good afternoon, everyone. Thank you for joining us for today's webinar, Raise the Age Training and Technical Assistance Center, Lessons Learned from States that have raised the age. My name is Allison Friedman, and I'm with OJJDP's National Training and Technical Assistance Center. As your technical host, I would like to take a couple of minutes to discuss a few features of the Adobe Connect webinar platform and provide a few announcements to keep in mind. For those wishing to download a copy of the PowerPoint slides and webinar-related handouts, you may do so by locating the Handouts pod directly above the chat area. Click on the name of the file and then click the Download button. At the end of today's webinar, there will be a Q&A session where the presenters will address some of the questions posed during the presentation. Please type your questions into the chat box as they arise. For those of you participating in today's webinar as a group, please take a minute and help us count. Go to the chat window and type in the total number of additional people in the room with you today. If you are viewing alone, there is no need to type anything into the chat pod at this time. Following today's webinar, attendees will be sent a certificate of attendance. This certificate is sent approximately 1 hour following the conclusion of the event and is sent via an Adobe Connect thank you email. Please keep an eye out for your email certificate. Finally, this event will be archived in approximately 3 weeks on OJJDP's online university at ojjdpou.org, where you can also find additional resources and view past webinars. Again, thank you for joining us today. I will now turn it over to Katie Penkoff from the Raise the Age Training and Technical Assistance Center to begin today's webinar.
Welcome, and thank you for joining us. My name is Katie Penkoff, and I am the Project Director for the Raise the Age Training and Technical Assistance Center. The mission of the center is to provide states with an age of criminal responsibility set under 18 with the research and data needed to make informed decisions about their justice policies. This is the second webinar in a 5-part series. I will serve as the moderator for today's webinar. And as Ali said, please note that the handouts are in the handout pod for today's presentation. And please place your questions in the chat box, and we will address those during our question and answer session. We are fortunate to collaborate with the Justice Policy Institute, the Campaign for Youth Justice, and the TOE Youth Justice Institute for today's webinar. I would like to briefly introduce our presenters and thank them for sharing their time and expertise. Joining us today are Mark Schindler, Executive Director of the Justice Policy Institute, Jason Zeidenberg, Director of Policy and Research at the Justice Policy Institute, Marcy Mestret, Chief Executive Officer of the Campaign for Youth Justice, and William Carbone, Senior Lecturer and Executive Director of Justice Programs, Director of the TOE Youth Justice Institute, and Director of Experiential Education at the University of New Haven. You will find more information about each of our presenters in the email that was sent out yesterday, including our bios. Through participation in today's webinar, attendees will understand the processes states use to raise the age of criminal responsibility, learn about the 7 strategies states employ to contain costs and enhance public safety while absorbing 16 and 17-year-olds into their youth justice systems, as well as learn from the experiences of stakeholders in Connecticut, Illinois, Massachusetts, and other states as they implemented this policy change. I will now turn the presentation over to Marcy Mestret, who will set the stage for today's webinar. Marcy?
Thanks, Katie, and to OJJDP for putting together this webinar, and welcome to all of our listeners. I'd also like to give special thanks to the Justice Policy Institute for issuing this critical and timely report. Through a careful examination of JPI's recent report released, Raise the Age, Shifting to a Safer and More Effective Juvenile Justice System, participants will learn the process states took to raise the age of juvenile jurisdiction and how acts of legislation were part of larger reform efforts within these states to make juvenile justice systems more effective and fair. As the Justice Policy Institute has found in their research, states that have raised the age of criminal responsibility have curbed overall costs, enhanced public safety, and successfully managed the change of absorbing 16 and 17-year-olds into the juvenile justice system by shifting towards a more developmentally appropriate approach. As the CEO at the Campaign for Youth Justice that works to end the prosecution of youth into the adult system and to build more effective responses to youth crime, the findings in this report provide a great roadmap for the final 6 states who are considering raising the age, as well as for those who are beginning to implement successful reforms. Over the past decade, a robust body of evidence has been developed that supports raising the age of criminal responsibility to 18. As a result, state policymakers and state stakeholders have, for the most part, changed their line of questions from why they should raise the age to how they should. The reforms have been supported across the political spectrum, and this year, every one of the remaining 6 states have or had active legislation to raise the age. So what is raise the age? As many of you know, when the juvenile court was established and states began building a separate system for young people, recognizing their diminished culpability and great propensity for change, every state established its own unique system. There was no research or federal policy to help guide the states in their decision-making. The vast majority of states set the age of criminal responsibility at 18, the age widely accepted as a time to be considered adulthood. However, some states established the age below 18, and a few have lowered or raised the age during crime ebbs and flows over the past several decades. For states to establish the age below 18, raise the age campaigns are an attempt to raise the age of criminal responsibility to age 18, ensuring that children, as they are still growing and developing, have access to age-appropriate services that their families are engaged in for treatment, and the bad decisions they may make in their early childhood don't follow them the rest of their lives. Raise the age is also critical because it greatly reduces the largest pathway of youth into the adult system. When the jurisdictional boundary is set at 18, we dramatically reduce the numbers of children in the adult system, and that helps to improve public safety. This change to a more developmentally appropriate system is successful, and states can get it done. Those states that have passed and implement raise the age have found that it is safer for communities. Youth tried as adults are more likely to reoffend and commit more serious offenses if they do reoffend as compared to youth retained in the juvenile justice system. It is also safer for young people. Raising the age means that youth are less likely to experience the trauma and victimization that's been documented to occur when youth are held in adult facilities. Raising the age supports state efforts to comply with the Prison Rape Elimination Act and keeping those youth who are under 18 separated from the adult population. It also is better for young people. The data shows that justice-involved teenagers are more likely to move past delinquency and successfully transition to adulthood if they are served by a developmentally appropriate system, the juvenile justice system, not the criminal justice system. And finally, it's a matter of fairness. Youth of color are most directly impacted when youth are automatically excluded from the juvenile court. For example, 9 out of 10 young people sentenced to prison from New York City are young people of color. In North Carolina, African American youth are 62% of the youth prosecuted in the adult system. Changing these laws benefits many of these young people. Momentum is building. In the past decade, we have gone from 14 states that needed to raise the age down to 6. All states that have changed their laws have included both misdemeanors and some felonies. Finally, all states continue to retain other transfer mechanisms. So while raising the age is critical, it's not the end of our work. The best data available shows that these reforms have cut the number of youth in the adult system nearly in half to about 90,000 children a year. If you add in the recent reforms made in South Carolina, Louisiana, and New York, these numbers will drop again, perhaps by 1/3 to 1/2 of the numbers of the decreases we've already seen. Children and public safety are benefiting, and states are figuring out how to implement this without breaking the bank. I will now turn it over to my colleague, Mark Schindler, from the Justice Policy Institute for more details on the report.
Great. Thank you, Marcy. It's really a pleasure to be here, and thanks to our colleagues for hosting us at OJJDP and AIR. It's really, we welcome the opportunity to share the findings from our report, which we essentially conducted because we wanted to help inform the policy discussions going on around the country based on the experiences of the 7 states that have raised the age over the last decade or so. What we found when we started this process is that there were concerns that prior to raising the age, some juvenile justice stakeholders had said taking on responsibility for 16 and 17-year-old youth would overwhelm the youth justice system and that costs would rise dramatically. These concerns have also been raised in some of the states that have more recently been considering raising the age. But what we found is that in state after state that raised the age, these predictions did not materialize. Throughout this presentation, you'll see some graphs from the full report, and you can see more information by downloading the report. In this graph that we're looking at here, we see what happened in Connecticut. You'll hear more about Connecticut later on in this presentation. There, despite a projected $100 million increase, costs remain roughly the same. And during this time, Connecticut also increased their investment in effective community-based approaches. Here's another graph showing what happened in Illinois as it relates to caseloads. In Illinois, there was concern that the juvenile court system would be overwhelmed. But in fact, as the slide shows, there were actually reductions in the number of cases in juvenile court. We also saw, and this is a key finding, that states that raised the age saw juvenile crime and confinement fall. In fact, the first generation of large states that raised the age outperformed the rest of the country in decreasing percentages of violent and property arrests between 2005 and 2015. So here in this chart, we see reductions in both property and violent crime in Massachusetts, Connecticut, and Illinois, showing that predictions about juvenile crime rising were not accurate. Also, the first generation of raise the age states significantly outperformed the rest of the country in reducing the number of youth committed, confined, or placed out of the home. We found that across roughly the same period, these states experienced reductions in the numbers of confined youth, showing that even after raising the age, states saw declines in both juvenile crime and confinement. So as we were doing this research, we had to ask the question, why weren't juvenile justice systems overwhelmed, as the concern many people had when they raised the age? And we found 3 things that were true across the jurisdictions. 1, juvenile crime fell and continued to fall. 2nd, fiscal impact statements were often limited and overestimated the costs. And 3rd, resources were reallocated from confinement to community-based approaches. We also found that strategies that states used to reallocate resources from confinement to the community were key. The 50 states and the District of Columbia all have unique features in how their juvenile justice systems work. This means the state may have to develop its own pathways to advance a better juvenile justice approach that fits with the specific structure and context of its own youth justice system. Not every state used the exact same steps to shift to a more developmentally appropriate approach, and not every state took such steps prior to raising the age of juvenile jurisdiction. For example, in Connecticut and Illinois, stakeholders advanced developmentally appropriate changes to help them implement raise the age in the years that followed the initial absorption of older teens into their juvenile justice system. Places like Georgia, New York, North Carolina, Michigan, Mississippi, Texas, and Wisconsin have already enacted the kinds of significant reforms that match those embraced by Connecticut and Illinois after they raised the age legislatively. A key finding from the report is that juvenile justice systems in states that have raised the age or are considering such legislation have taken steps to move towards a more developmentally appropriate approach by using the following strategies. First, expand the use of diversion. Second, make probation and aftercare approaches more effective. Third, address young people's mental health needs outside the deep end of the system. Fourth, reduce the use of pretrial detention. Fifth, reduced reliance on facilities and focusing resources on community-based approaches. Sixth, keep young people safe by complying with the Prison Rape Elimination Act, or PREA. And seventh, improving their system's management of resources and strengthen strategies to serve young people more effectively. During the webinar, I'll discuss these strategies in a bit more detail. First, expanded use of diversion. So we know that approximately 1 million youth are arrested annually, and nearly 95% of those arrests are for nonviolent offenses. So clearly there's an opportunity for diversion in the system. More developmentally appropriate juvenile justice approaches seek to ensure that when a young person comes in contact with law enforcement, they are not arrested or formally processed by the justice system automatically. Instead, these systems are finding ways to hold youth accountable through cost-effective approaches that help youth move past delinquency. Systems in Connecticut, Illinois, Louisiana, Mississippi, North Carolina, Michigan, and Texas have all taken steps to expand the use of pre-arrest or pre-adjudication diversion. And here you see a quote from an administrator in Michigan talking about what they did in terms of diversion of young people from the system. Second, make probation and aftercare approaches more effective. Annually, as many as 300,000 kids are on juvenile probation. Approximately 100,000 are returning from a juvenile facility. While community supervision is cheaper than confinement, probation, and aftercare approaches that are solely focused on conditions around surveillance and monitoring, like whether a youth is making curfew, keeping an appointment, or fulfilling restitution, are not in themselves effective at helping youth succeed. Instead of simply keeping an eye on youth or making them follow the rules, developmentally appropriate probation and aftercare focuses on engaging a young person in behavior change, partners with community organizations, and works with families, and attempts to limit the likelihood of a young person's supervision will be revoked. And we have a couple of examples from that. In New York, for example, in 2014, about 16% of young people confined were there for technical violations. There was significant efforts, particularly by the New York City Department of Probation, the largest office in the state, to improve their approach in order to reduce young people's system involvement. In the past, the department had focused more on identifying shortcomings of youth and less on their strengths. Now they're embracing a probation approach that builds a young person's assets through strength-based focus. By doing this, they've moved towards a more effective approach, and there's been a 45% decrease in violation rates between 2009 to 2012. I think this is an area in which we can make significant progress in the field in coming years. And I know groups like the Annie Casey Foundation and the RFK National Resource Center, in partnership with others, are working on these issues, and I'm sure we'll be sharing information with the field moving forward. Third, addressing young people's mental health needs outside of the deep end of the system. While most youth in the system have mental health challenges that can be addressed through treatment or therapy that allows a young person to remain with a guardian at home, when a young person's mental health challenges are not addressed, their health conditions can deteriorate and lead to lifelong consequences, including justice system involvement. A more developmentally appropriate approach connects youth to community-based mental health services and helps youth get the treatment they need in a way that does not deepen their juvenile justice system involvement. Systems in Louisiana, Massachusetts, Michigan, Texas, and Wisconsin have all developed mechanisms to address young people's mental health needs outside the deep end of the system. Jurisdictions that address a young person's mental health needs in the community in turn keep more young people out of the deepest end of the system. Through this approach, states and localities partner with public health systems to connect youth who are diverted on probation, in aftercare, or in detention alternatives with treatment while they're at home. These approaches to addressing a young person's mental health needs outside the system are also more cost-effective than pushing youth deeper into the justice system. More of these services can be funded by federal funding streams or state-based health funding systems than those services provided within juvenile justice facilities. In other words, addressing a young person's mental health challenges in the community is a way to save taxpayers money and reduce reliance on more expensive options that needlessly deepen a young person's justice system involvement. We have some examples of this. I think I'll save those for question and answer. If you have questions, please let us know. The fourth strategy that we saw was reduced use of pretrial detention. It's estimated that hundreds of thousands of young people may experience pretrial detention on an annual basis, and we've seen lots of progress in this area in recent years. Compared with the range of other ways systems can ensure that a young person shows up to court, pretrial detention is expensive. Over the course of 20 years, a single detention bed can cost the public between $1.25 million and $1.5 million, or up to $65,000 per year. Because of the negative impact pretrial detention has on young people's individual trajectories and public safety more broadly, local and statewide juvenile justice systems in over 300 counties and 39 states are working to implement components of the Juvenile Detention Alternatives Initiative, or JDAI, that I'm sure many of you are familiar with. An effort that seeks to reduce overall pretrial detention while systematically strengthening systems through a combination of strategies. Mississippi raised the age for 17-year-olds convicted of felonies in 2010. 2 years before Mississippi passed its raise the age law, JDI expanded in 5 counties across the state. Between 2007 and 2013, there was 42% decrease in the rate of use of out-of-home placement, pre- and post-adjudication. Fifth, reduced reliance on facilities and focused resources on community-based approaches. We've seen that policymakers have redeployed existing taxpayer dollars to support programs that serve young people closer to home, at home, or in their communities, and have reduced the number of young people placed in the most expensive options. And here we see a quote from Senator Murphy in Connecticut talking about their experience there. By keeping more youth at home or in their communities, juvenile justice systems that are raising the age are better able to refocus resources to serve more youth in a more cost-effective way. Juvenile justice systems in almost all the states that raise the age or are considering raising the age have taken steps to reduce reliance on facilities and focus resources on community-based approaches. And again, I'll reference the report, and you can see examples that we go into more detail within the report and the findings that we had. And here we have a statement from the Illinois Juvenile Justice Commission saying that they are not requiring new facilities post-raising the age. Sixth, keep young people safe by complying with the Prison Rape Elimination Act. The PREA of 2003 ordered that any individual under the age of 18 who is incarcerated must be sight and sound separated from adults in order to comply. PREA has become a catalyst for Raise the Age initiatives by galvanizing stakeholder support for states and localities to avoid the increased taxpayer costs that would result from having to alter the physical structure of adult facilities to comply with federal law. Rather than relying on retrofitting jails or prisons or adult facilities where it is well established that young people are more likely to come into harm's way, sheriffs and adult corrections officials have called on policymakers to raise the age in order to keep youth safe. Sharing some information from some of the states that have raised their age. Here you have a statement from Massachusetts about how PREA interacted with their efforts there. And here a quote from a sheriff talking about the dangers of having young people in their facilities. And finally, improve juvenile justice system's management of resources and strengthen strategies to serve young people more effectively. In the past, we've known that systems have not often had access to or used tools such as needs-based assessment instruments to ground decisions on the best way to serve young people. Instead, stakeholders may have developed their approaches for responding to young people's behavior based on more subjective factors and didn't tailor those approaches to strategies that were proven to help youth move past delinquency. Today, we're seeing an increased reliance on objective tools that help assess what a young person needs and identifies potential risks associated with his or her prior behavior. That's going to help determine what intervention will best address those risks. Additionally, systems are increasing reliance on tools to help structure decision-making with regard to the best way to serve youth, consistent with the best practices and the most effective use of scarce resources. These tools are increasingly being used throughout juvenile justice systems, and we saw this particularly in the states that we studied. It's important to note that the tools are not designed to replace the in-depth individual assessments conducted by juvenile justice professionals in order to decide how best to serve youth, but rather they're used to improve how systems serve the young people that they're coming into contact with and to provide better information to stakeholders to make good decisions. And again, we saw this in systems in Connecticut, Georgia, Massachusetts, Michigan, Missouri, New York, North Carolina, and Texas. It's a quote from an administrator in Mississippi. So wrapping up, just a couple of thoughts on steps that policymakers can take to successfully implement raising the age. And again, this was based on us taking a deep dive and looking at the 7 states that had raised the age over the past decade and the lessons learned from those states. Essentially, what we saw to overcome the operational concerns, and clearly there are going to be operational issues about the potential impact of raising the age, elected officials, juvenile justice leaders, and policymakers can take several steps. First, assess what current steps have already been taken to improve a state's approach to juvenile justice and explore opportunities to expand those efforts. Second, connect with stakeholders in the states that have raised the age. We now have people around the country who have had these experiences and are able to walk folks through how it worked and what the challenges were in their particular state. And third, seek out technical assistance on how to continue shifting towards a more effective and developmentally appropriate juvenile justice approach. And I think those are clear steps that folks can take as they consider moving forward. As I mentioned earlier, Connecticut is an example of a state that raised the age and implemented strategies consistent with the approaches that I've just outlined. I think this is a good time to turn it over to my colleague, Bill Carbone, of the Tau Youth Justice Institute, who played an integral role in the planning and implementation of Connecticut's Raise the Age process. So in hearing from Bill, we're going to hear from an administrator who was involved in the planning and the execution, and he'll be able to walk us through the experience in Connecticut. Thanks very much, and I'll turn it over to you, Bill.
Thank you very much, Mark, and to all of you. I'm very pleased to be with you this afternoon and to share with you Connecticut's unique experience in our Raise the Age initiative. Before you on the slide is the outline of my presentation, so I'm going to give you a little background on our state and some of the things that may make us different from other states. Talk to you about the larger reform effort that was happening coincidental with the Raise the Age, and I think the two together are really responsible for the positive outcomes that we are now seeing. Tell you about Connecticut before we began to make reforms, including Raise the Age, and tell you about what it looks like now. So my first is to give you a little background on our state. Connecticut is rather unique in that the juvenile justice system is really across not just two agencies of government, but two different branches of government. The state judicial branch, for example, oversees all of the juvenile probation offices in the state. As well, it manages the 2 juvenile detention centers in the state, and this has long historically been true in our state. The branch also, very much unlike many other court systems, directly contracts for a variety of services that are provided to the children and families who are under some form of court supervision. At the same time, in the executive branch, through our Department of Children and Families, we have the Connecticut Juvenile Training School, as well as the Parole Division. We have only one training school in the state of Connecticut to which any adjudicated offender can be sent. Also of importance in better understanding our state, we do not have county government. So we have a very strong state government in Connecticut, 169 towns and cities. We do not elect judges in our state. They are all appointed by our governor and subject to reappointment as well by our legislature. We have 100 local police departments. The balance of the state is covered by state police. And finally, since 2007, juvenile crime rates in Connecticut, following the national trends, have been continually dropping. It would be important to explain to you that the Raise the Age initiative in Connecticut was occasioned by many, many other efforts to reform the juvenile justice system. So what I'd like to do is to tell you what some of those reforms were, because I think they are very much responsible for the good outcomes that we are getting. Connecticut has made a major effort to divert kids away from the system. So for example, status offenders in our state. It was decriminalized many years ago in the middle of the 2000s. And frankly, status offenders are not allowed in our detention centers and haven't been now for several years. We've also given authority to the school systems, to the probation departments in our state, that when referrals are made to the court from school systems for various school arrests, if they don't rise to the level that we think they belong in courts, they have the right to send them back for some kind of an alternative response. So we think it's very important, as you're thinking about truancy and running away and kids who are out of control of their parents, that we make every effort to try to remove them from the system. At the same time, we have a lot of minor offenders that come into the system, and we know from our own experience here that just coming into the system alone can be very harmful. So we've been working with our police departments to get them to use the discretion that they have under the law to really divert at their level and to find some alternative to arresting children and sending them to the courts. We have over 80 juvenile review boards in our state that can screen these cases and try to help the police to make a more local decision rather than arresting kids. And that effort has been very, very important to our state. Another reform that I think is very important to bring to your attention is that we've been reducing incarceration and reducing recidivism and making very determined efforts to do that. For example, in Connecticut, we have been investing in a lot of resources that would be considered proven effective. Our probation system many years ago adopted the use of validated risk assessment tools, so we can be sure that we have each child properly assessed for risk and need, that their interventions can be sequenced over the course of the probation. We invested in manageable caseloads. We trained officers in things like motivational interviewing, in trying to identify the strengths that each child has and to build cases on that. We also had a tremendous investment in community resources and in the kind of community resources that I think are really the ones that we should be investing in. things like in-home services, multi-systemic therapy, for example, functional family therapy. We have our own unique program in Connecticut called Intensive In-Home Child and Adolescent Psychiatric Services. So these are programs that have a lot of research that they actually work and are effective at reducing recidivism. We also invested in a lot of the CBT programs, the cognitive behavioral group therapy around the state. And by the way, because our state is fairly small, we were able to make these programs available across the state. We infused trauma-informed programming into all of our local contracts. We invested significantly in educational support services so that kids who were being diverted from the system or kids who were being placed in community services had access to advocates that can help them to get back into the school system. So Connecticut really began many of the reform efforts that were going on at the same time as we were beginning to raise the age. And very importantly, we didn't overlook the efficacy of quality assurance, of making sure that the programs that we were putting in place were actually being carried out the way the authors of those programs and the architects of those programs intended. We have wonderful data systems in our state, so we were able to put systems of accountability in place so that we could continually measure the difference that we were making at increasing diversion, decreasing incarceration, and decreasing recidivism. So I'm going to show you some charts that take us from before we raised the age in Connecticut to now several years later. And I would ask that you keep in mind the continued development of many of the reforms that I just mentioned. So before we began reforms, Connecticut had a very high court intake. Every year it kept going up. We had very high admissions to our detention centers. In fact, we had a major lawsuit called Emily J. that began back in the 1990s, and it really challenged our conditions of confinement, the lack of specialized mental health services, and the fact that many kids were languishing in detention over long stays. We had status offenders sitting in detention centers with delinquents. We also had a high number of commitments to out-of-home placements, which included incarceration. Prior to our reforms, we didn't really have any evidence-based programs such as the ones that I've already described. We had programs that had been in existence and created really without much research, and we even had a legislative study in our state that said they were really ineffective. They were not reducing recidivism. And I can tell you before reform, we had 16 and 17-year-olds as part of our adult system in Connecticut, and we measured that quite well. And we found that this group, in the context of the adult criminal justice system, they had very low completion rates in programs and very high recidivism rates. So here we look at the first chart that I'm pleased to share with you. This looks at referrals to the court in the state of Connecticut from 2008 all the way to 2016. Now, the number of juveniles is down by 21%, which may not sound like much. But if you look at where the two arrows are, you can see that in 2010, we began to put 16-year-olds into the juvenile court system, and then in 2012, 17-year-olds. By way of comparison, we had as many 16 and 17-year-olds in the adult system as we did under 16-year-olds in the juvenile system. So it's quite remarkable when we had this anticipated doubling of the court intake as a result of Raise the Age, that none of it happened. That in fact, what happened was changes in practice as the Raise the Age went into effect. Police and communities engaging in much, much more diversion, juvenile crime coming down, and the use of programs that turned out to be much, much more effective. A surprise? Yes, it was. But this really, I think, is a good indication of why the reforms have to be done in concert with Raise the Age. This is a look at our detention system in Connecticut from 2007 through the end of last year. And you can see there was a 44% decrease in the average daily population. Why is this significant? Because in 2010, we added 16-year-olds, and in 2012, the 17-year-olds. And we really thought this was going to mean we'd have to build more detention centers. Not true. We actually closed one, and as of now, we have about 35 kids in 2 centers that have room for 176. And that's because just since January 1, our reform effort has continued, and our state legislature reduced the criteria for admitting kids to detention so that the only kids who are getting in now are those who are really a threat to the public. Other kids are being treated at the community level. This looks at something very important. It looks at how long kids were staying in detention. Again, one of the fears we had when we raised the age is not only were the detention centers going to get overcrowded again, but kids were going to stay there longer and longer. So we've had a better than 20% decrease in the average number of days that kids stay there. And I can tell you that since January 1 of this year, it's actually down to 8 days. How did we do that? Our legislature last year said instead of having hearings on detained kids every 14 days, you must have them every 7 days. Riverview placement, what that means are kids who have significant mental health issues, so significant that they need to be hospitalized. Again, this was part of the lawsuit with our detention center, that kids were actually decompensating in the detention system because it was taking so long to get them into the proper placement. 82% decrease in the amount of time. And how did this happen? Once again, reforms, introducing different types of evaluations that could be done much more quickly to facilitate the admission to the state hospital. This is another interesting chart. We had many kids that were in our detention system because the residential placement to which they were going to be assigned was not ready. The threat was with 16 and 17-year-olds coming in, an older population, perhaps more challenging, more independent, that these waits were going to lengthen. That has not happened, a 38% decrease. Why? Because we've taken some of the money that we saved by reducing the incarcerated population, and it's been invested in more community resources so that the wait can be reduced and kids can get into a more effective intervention sooner. This is the one I am most proud about because this is the number of kids who are taken out of their homes and either for residential placement or for incarceration. You can see that in 1999, we had 687 kids that year in the state of Connecticut. Last year, it was 156. Think about the cost savings here. In Connecticut, it is exceedingly costly to keep one kid in placement at our training school or in a residential location. To create the community placements that are alternatives is not only much cheaper, but it's much, much more effective. And so we have far fewer kids leaving their home communities, and as a consequence, Connecticut is now looking at closing the only training school that we have. We have legislation and the governor's support. It will be closed by July 1 of 2018. And the replacement will be community-based treatment programs that will be suited to the delinquent population. So we've put a lot of kids into the community. And what you're looking at here is the reduction in recidivism for a group of them, those who are adjudicated in our juvenile courts and who are placed on probation. And we look at where they are 24 months later, and we found that after years of recidivism rates either remaining stagnant or going up, they're going down. 15% now since 2007 and continuing to go in the right direction. And even though we're now dealing with older kids, 16 and 17-year-olds, the rates are continuing to drop. My experience with the older kids, by the way, in the juvenile system, is that since we have put 16 and 17-year-olds in, they actually have higher completion rates and lower rearrest rates than the kids who are under the age of 16. And another very important impact is what it's doing to the adult correctional system in our state. The number of 18 and 21-year-olds in our adult system in Connecticut has decreased by 60% since 2009, the year before we began to put 16-year-olds into our juvenile system. We went from having 2,092 18 to 21-year-olds in our adult correctional system down to 840 by the end of last year. So this tells me that a lot of the kids that were not being handled well in the juvenile system and ultimately graduating into the adult correctional system, that's changed because we put these reform efforts in place. So where we are now after reforms is all the things that were going up before are now going down. Intake, detention, out-of-home placements, crime rates, probation, recidivism, and not only are just status offenders in our state out of the detention system, however, our state has also removed truants from being referred to the juvenile courts. That's effective in August of this year. And so we're moving steadily in the right direction, not only continuing the raise the age efforts, because our governor has proposed raising the age in Connecticut up to 21. That is still under review in the legislature. And at the same time, continuing our reform efforts along with it. So I will stop at that point, and I think, Katie, I turn it back over to you.
Thank you so much, Bill. We greatly appreciate your time and expertise. So at this point, we are going to move to the question and answer period, and many questions have come in over the course of the webinar. So the first question is, do the figures include those youth who cross over from abuse and neglect to delinquency? And Mark and Jason, I believe this is a question that was related to your use of pretrial detention numbers that you shared earlier in the presentation.
Hi, this is Jason Zeidenberg from the Justice Policy Institute. Thank you again for convening us today. The figures that report on the use of juvenile detention and juvenile confinement, they do include young people that also have involvement in the child welfare system. It just wasn't broken out that way in the national data sets or the state data sets.
Right. Thank you very much.
And this represents an opportunity for any system that wants to try to achieve a service or pay for a service with a young person that's fully involved.
All right. Thank you so much, Jason. Our next question, it comes from Texas, and the participant states that they've already made many of the reforms that we're speaking about during today's webinar, and as a result, they've vastly reduced capacity in juvenile detention as a result. So this lack of capacity in the facilities still remains one of the main arguments or concerns for raising the age. And so the participant asks, do we have any suggestions for addressing that concern? And so Bill, can I pose that question to you?
Sure. So I think it really requires you to look at who's going into your detention. As I understood your question, it was about the detention system, which would be pre-adjudication, correct?
Yes.
So I think you have to look at who's going in, and that really will help you to figure out the capacity and how to reduce it. Are you still allowing status offenders who violate a condition of a court order to be detained? Because that's one thing that we eliminated here some years ago. That removes one group. The other thing you need to look at is what are some of the criteria for admission to detention? Can the police simply on their own decide that a youngster needs to be detained? And will they then admit them if the police bring them there? We need certain criteria that establish either the offenses for which the police can bring a youth to a detention center, or, as we've done in Connecticut, require the police to get a court order before a child can be detained. Another thing you need to look at is how many kids are in your system because they're waiting for something else to happen, either some kind of an evaluation that's specialized either for substance abuse or for mental health or for sexual dysfunction. How long is it taking to get those evaluations done? Are there ways to expedite that? And are they also waiting after the evaluation is done for the placement? Can you use some of the savings that are happening in the system to create more placements? So my approach to reducing the capacity is that you have to really look at what is the purpose of detention and look at the populations they're in and see if there are other ways, and I'm sure there are other ways to address them that will not be a threat to public safety, that will probably be more effective in the long run. I really do believe that placing kids in detention, even modern detention centers, really has to be the absolute last resort, because the mere contact of putting kids in centers where they're mixed with more serious kids, where just the notion of being in that kind of a confined space really sends a powerful message to kids that maybe they're bad, that there's something wrong, and kids tend to go out and live up to what they think are societal expectations of them. So that's what I would recommend to Texas.
Okay, thank you so much, Bill. The next question is, what type of partnerships have you seen between probation and parole and community-based organizations that support reducing youth recidivism?
Do you want me to answer that, Katie?
Absolutely. Thank you, Bill.
So I think partnerships are an absolute key here. My sense, and I ran probation in Connecticut for many, many years, it's a 50-50 proposition. Without our partners in the private sector, for example, the people who deliver the direct services, whether it's evaluations, whether it's outpatient substance abuse or mental health, whether it's residential programming, whether it's any of the cognitive behavioral therapies or any of the in-home services, that's the other 50% of the proposition. So there needs to be partnerships with the private service agencies. Another critical partner here are the schools. So many of the kids that were coming into our system in Connecticut were coming in because of offenses that were occurring in the schools or school-related. And you know, a lot of them were for things that when I was in school, I used to observe these things would happen. Kids would get sent to the principal's office. We found in Connecticut they were getting sent to the court. So we did a number of things, including developing some model programs for the schools to use to try to reduce expulsions, suspensions, and school-based arrests, giving them assistance with policy development, linking schools to some of the community resources that they can use. For example, in Connecticut, we have an emergency mobile crisis team that they can call when they observe certain behaviors that maybe they think are simply efforts to be disruptive, but in fact it's indicative of some kind of a mental health problem that a child has that would be much, much more appropriate than calling the police and getting the child arrested. So I think absolutely we need to look way beyond the juvenile justice system and really connect with the private sector, with the schools, and really with any other community resources that can be helpful. Something as simple as connecting with the housing resources, as we find so many kids are living in homes, you know, where they're subject to evictions or they don't have health care, and trying to bring that about. So all of these linkages, I think, are very critical if we want to get good outcomes.
Great. Thank you so much, Bill. There is another question regarding capacity, and still a state that has worked through many of these reforms, and there is still a concern that the state will need more funding to support more FTEs or staff positions for this policy shift. So Mark, Jason, Marcy, have anything to add there?
I believe that question, this is Jason Zeidenberg again, I believe that question is coming out of the Texas frame and Texas's specific challenges around these issues. I think one thing that needs to be emphasized, as was the case in Illinois and Connecticut and Massachusetts, is most of the kids that will benefit from raising the age will not require that level of care. There really will be young people coming in on nonviolent, non-serious offense, will not have a great treatment need. They can go home, as in many cases they are in the adult system now, just without all the collateral consequences that come with an adult conviction. The situation in Massachusetts and Illinois and Connecticut should be a roadmap and also give people in Texas just a little bit of air in the room to think about these issues. None of these three states that we're talking about today are finished with their juvenile justice process. Texas has taken great strides to make better use of risk and needs assessment, take better steps to address a young person's mental health needs in the community. That's not to say Texas is done. What we're saying is there's resources to be leveraged both from federal funding streams and state funding streams that can help deal with the overburden of the corrections budget in terms of addressing these young people's needs. And also, there are bigger steps that many counties across the country, including in a place like Texas, can do to have fewer kids confined at the local level or confined at the state level.
Thank you so much, Jason. Unfortunately, we are out of time. We have plenty of questions that have come in over the course of the webinar, and we will be addressing those. We have an online community of practice, and we can capture all of the questions today, and we will work to systematically address those questions. Part of what we can do is also reach out to people who have registered via your email addresses with responses to the questions. And so, NTTAC and Ali, I will turn it back over to you.
Great, thanks, Katie, and thank you to all of our presenters for such a great discussion. We just have a few quick reminders that we'd like to go over. So the first is that this webinar will be archived on OJJDP's online university in approximately 3 weeks. For more information about this, please contact Raise the Age Training and Technical Assistance Center. And you may also contact OJJDP or NTTAC via the Help Desk by following the contact information on the slide. Also, please take a moment to complete the online evaluation. And then thank you again just for joining us today. We really appreciate, yep, there you go. There's the link to the feedback form. So please just take a moment to do that. And that's it. Thank you all so much for participating today.
Thank you all. Have a wonderful day.
Take care.